My name is Zixthar, and I'm the Senior Containment Officer for the Galactic Health Consortium. That's a fancy way of saying I'm the one who gets called when biological nightmares start spreading across star systems. I've seen plagues that liquefy your internal organs. I've witnessed viruses that rewrite your genetic code while you're still alive. I once had to evacuate an entire planet because someone brought back a fungal spore that turned thinking beings into mindless spread vectors. So yeah, I've seen some things, bad things. Things that give me nightmares even though my species doesn't technically sleep. But nothing, and I mean nothing prepared me for the day I received a distress call from human space. Let me back up. Humans had joined the galactic community about 15 years prior to this incident. They came from Earth, a Category 8 death world, which should have been everyone's first warning sign, but they seemed nice enough. A little weird, sure. They had this disturbing tendency to keep deadly predators as pets, and they voluntarily poisoned themselves with something called alcohol for fun. But overall, they seemed relatively harmless. They set up a few colonies, started trading, made some friends, the usual new species routine. Everything was going fine until it wasn't. The call came through at 400 station time, emergency frequency, maximum priority. I was still groggy when I answered, my tendrils fumbling with the communicator. This is Zixthar, containment officer on duty. What's the situation? The voice that came back was human male, speaking way too fast. Officer Zixthar, this is Dr. Marcus Webb, chief medical officer aboard the UTSS Perseverance *. We have a code black situation. Repeat, code black. We need immediate quarantine protocols for the entire Kepler 442 system. I was suddenly very awake. Code black meant complete biological breakdown, extinction level threat. What's the pathogen? I asked, already pulling up the system maps. Unknown origin. Symptoms include rapid cellular necrosis, airborne transmission, 100% fatality rate within 48 hours of exposure. It's already spread to 3 colonies, estimated 40,000 infected. My organs clenched. That was bad, really bad. I'm initiating emergency protocols now, I said. Dr. Webb, you need to evacuate everyone who isn't infected and seal those colonies. We'll send containment teams. Negative, Webb interrupted. We're not evacuating. I stopped mid-command. Excuse me, we're not evacuating the system. We're containing it here. That's why we called you. We need to make sure no one else comes in or out until we handle this. Dr. Webb, I said slowly, you just described an extinction-level pathogen. Your containment teams will be dead in 2 days. You need to evacuate the healthy population now before. Officer Zixthar, another voice cut in, this one female and absolutely calm. This is Governor Sarah Chen of Kepler 442b. We appreciate your concern, but we have the situation under control. We're calling you to establish an official quarantine perimeter, not to request evacuation. Governor, with all respect, you do not have this under control. No one has a bioweapon like this under control. The only safe option is immediate evacuation of all healthy individuals and complete sterilization of the infected zones. We're not leaving our people behind, Chen said flatly. Your people are already dead. I didn't mean to shout, but honestly, were they insane? Everyone infected will be dead within 48 hours. You said so yourself. And anyone who stays to help them will just become infected too. This is basic containment protocol. Our protocols are different, Webb said. Your protocols are wrong, I shot back. Governor Chen, I am formally recommending immediate system evacuation under Galactic Health Consortium authority. Recommendation noted and rejected, Chen said. We will handle this ourselves. We just need you to keep everyone else out until we're done. Until you're done dying, you mean? There was a pause, then Chen said very quietly, Officer Zixthar, have you ever heard of the Black Death? Number should I have? How about the Spanish flu, the 1918 pandemic? No, what does this have to do with? What about HIV, Ebola, COVID-19? I don't know any of those things, I said, frustrated. No, you wouldn't, Chen said, because they're Earth diseases, plagues that swept through human populations and killed millions, tens of millions in some cases, and do you know what we did every single time? I said nothing, we stayed, Chen continued. We didn't run, we didn't abandon our sick, we stayed and we fought, we developed treatments, we created vaccines, we adapted, that's what we do, officer, we don't leave people behind. That's very noble, I said, and very stupid. You can't fight this. No one can. The only reason the galactic community has survived as long as it has is because we follow containment protocols. We cut out the infection before it spreads. By abandoning entire populations to die alone, Webb asked. By saving everyone else, I replied. It's basic triage. We don't do triage on entire populations, Chen said. That's not who we are. This was going nowhere. I switched tactics. Fine, let's say you stay. Let's say you try to fight this. What's your plan? We're already implementing it, Webb said. I could hear him typing in the background. We've isolated all infected individuals in negative pressure medical facilities. We've got research teams working on identification and treatment protocols. We've initiated contact tracing for everyone who might have been exposed. And we've begun genetic sequencing of the pathogen. In 48 hours, everyone working on this will be dead, I pointed out. Then we'll have fresh teams ready to continue their work, Chen said. We've already issued a call for volunteers, medical staff, researchers, support personnel. They know the risks. They're coming anyway? That's insane. That's human, Webb corrected. I sat there for a moment trying to process what I was hearing. They were volunteering to walk into a hot zone, volunteering to expose themselves to a pathogen that had a 100% kill rate, volunteering to die. Let me make sure I understand this, I said finally. You're asking me to seal off an entire system, trapping yourselves inside with a plague that will kill everyone because you want to try to save people who are already doomed? Not doomed, Chen said. Sick, there's a difference. Not with a 100% fatality rate, there isn't. Yet, Webb added. 100% fatality rate yet. That yet hung in the air like a challenge. You're going to fail, I said quietly. I've seen this scenario play out dozens of times with dozens of species. No one beats a code black pathogen. The best you can do is contain it and prevent it from spreading. That's why we have evacuation protocols. Then we'll be the first to beat it, Chen said simply. I wanted to argue more. I wanted to override their authority, send in consortium ships, force an evacuation. But technically, they weren't breaking any laws. They were volunteering to stay in a quarantine zone. That was, well, it was allowed even if it was suicidal. Fine, I said finally. I'll establish a quarantine perimeter, nothing in or out. But Governor Chen, Dr. Webb, I want you to understand something. In 3 months, when this is over and everyone in that system is dead, it's going to be my job to sterilize those worlds, to make sure nothing escapes. And I will do that job, do you understand? Perfectly, Chen said. We'll contact you in 3 months to arrange the all-clear inspection. There won't be an all-clear, I said. We'll see, Webb replied, and that was it. I filed the paperwork, established the quarantine perimeter, and waited for the inevitable bad news. 2 weeks later, I got an update. Purely routine, I had to monitor any active quarantine zones. I expected to see declining population numbers, maybe some desperate final messages. Instead, I got a data packet from Dr. Webb. Officer Zixthar *, it began, Week 2 update. Current infected, 3,847, down from 6,200. Fatality rate, 82%, down from 100%. We've identified the pathogen as a modified Kepler virus artificially weaponized. Treatment protocol showing promise using a combination of antivirals and immune system boosters, requesting updated quarantine timeline. I read it 3 times, then I called him. Dr. Webb, what the hell is this? Oh, good, you got my report. Which part would you like clarified? The part where you claim to have reduced fatalities on a 100% lethal pathogen. Oh, that. Yes, turns out it's not 100% lethal if you treat it aggressively in the first 12 hours. We've been pumping patients full of broad-spectrum antivirals, supplementing with synthesized antibodies and manually supporting organ function while their immune systems catch up. It's working. That's not possible. It's very possible. Difficult, expensive, requires round-the-clock care, but possible. We've saved about 18% of cases so far, hoping to push that higher as we refine the treatment. 18% is not. 18% is nearly 1,200 people who are alive right now who would have been dead under your protocols, Webb cut in. I'll take it. I didn't know what to say to that. We've also identified the source, Webb continued. Abandoned research facility on the third moon. Someone was developing bioweapons. Looks like containment failed. We've secured the site and destroyed all remaining samples. You went to asterisk the source? Into a weapons lab full of this stuff. Couldn't let it stay out there. Bomb disposal team went in with full hazmat gear. They knew the risks. Are they dead? 2 of them are in treatment. 3 made it out clean. Like I said, we're getting better at this. 3 months after the initial quarantine, I received another message, this time from Governor Chen. Officer Zixthar asterisk, it read, Day 90 update, 0 active infections, all patients recovered or deceased, total fatality rate 64%. We're requesting quarantine lift and consortium inspection team for certification. 64%. That meant they had saved over 14,000 people. People who, by every standard protocol in the Galactic Health Consortium handbook, should have been written off as casualties. I assembled an inspection team personally. I had to see this for myself. When we arrived at Kepler 442b, I expected to find a devastated colony. Ghost towns, mass graves, survivors traumatized and broken. Instead, I found a functional society. The capital city was busy, people going about their lives. There was a memorial in the central plaza, names carved in stone, thousands of them. But next to it was a medical research center with a big sign, Kepler Institute for Infectious Disease Research. Governor Chen met us at the spaceport. She looked tired, older than her file photo, but alive and healthy. Officer Zixthar, she said, extending her hand in that weird human greeting gesture. Thank you for coming. I shook her hand awkwardly with my primary tendril, Governor. I'll be honest, I expected to be certifying a dead system. She smiled. We get that a lot. Dr. Webb gave us a tour of the medical facilities. They were impressive, negative pressure rooms, advanced diagnostic equipment, isolation wards that put most galactic health stations to shame. We built all this in 3 months? I asked, incredulous. Some of it we built, Webb said. Some we had already, and some we adapted from existing structures. Turns out when you tell humans there's a plague to fight, resources appear pretty quickly. But how did you develop a treatment so fast? Most species take years to research a new pathogen. Webb led us to a laboratory where several humans in protective gear were working with samples. We didn't start from scratch. We had centuries of experience fighting diseases on Earth. We knew the basic principles: identify the pathogen, understand its mechanism, disrupt that mechanism. The specifics were new, but the approach wasn't. But the casualties, I pressed. Over 25,000 dead, that's too many, Chen said quietly. Every single one is too many, but it's 25,000 instead of 40,000. And it's 40,000 instead of the entire system population. We'll take that math, even though it hurts. One of the researchers, a young woman, overheard us. She pulled down her mask. My mother was one of the early cases. She died in week 1 before we had the treatment protocol working, but she was a virologist. Her notes, her research helped us develop the treatment that saved my father. He got sick in week 2. She pulled out a small data tablet and showed us a picture, 2 humans smiling, arms around each other. That's him, discharged 3 weeks ago, fully recovered. So yeah, we lost people, but we saved people too. That's what matters. After the inspection, after I had certified the system clean, Chen invited me to dinner. It seemed rude to refuse, even though human food was weird and I wasn't sure my digestive system could handle it. Over a meal of something called pasta, which was actually pretty good, Chen asked me a question. Officer Zixthar, how many systems has the consortium evacuated due to biological threats? I didn't have to look it up. 187 in the last century. And how many of those populations survived? All of them. That's the point of evacuation. No, Chen corrected gently. How many asterisk complete populations survived, including the infected? I was quiet for a moment. None. The infected are left behind by definition. 187 evacuations, Chen said. Millions of people left behind to die alone. How is that acceptable? It saves everyone else, I replied. It was what I had been trained to say. It saves some people by sacrificing others, Chen said. That's not the same thing. It's practical, it's efficient. It's the only way to prevent the spread. It's giving up, Webb interjected. He had joined us for dinner. It's deciding some people aren't worth saving. That's not fair, I protested. We don't have the resources to fight, Chen asked, to research, to try. She leaned forward. Officer, I'm not criticizing you personally. I understand you're following protocols that have been in place for thousands of years. But those protocols are based on an assumption that some threats can't be beaten, only avoided. Because they can't be beaten, I said. We just beat one, Webb pointed out. You got lucky. We got stubborn, Chen corrected. There's a difference. She pulled out her own data tablet and showed me something: medical records, research papers, genetic analyses. This is everything we learned fighting this pathogen. Viral structure, replication mechanisms, treatment protocols, vaccine development. We're sharing it with the consortium free of charge. Because the next time something like this happens, maybe you won't have to evacuate, maybe you can fight. I looked at the data. It was comprehensive, detailed, the kind of research that should have taken years. They had done it in 3 months while simultaneously treating thousands of patients and maintaining quarantine protocols. Why? I asked finally. Why share this? You could sell it, profit from it. Because next time it might not be us, Webb said simply. It might be your people, or the Pelion, or the Vrex, and we'd rather everyone knew how to fight than everyone knew how to run. 3 years later, the Pelion Compact had an outbreak. Category Red pathogen, high mortality, similar profile to the Kepler virus. I was the officer on call. I started to initiate evacuation protocols, then I stopped. I called Governor Chen. I need your help, I said. We're on our way, she replied. The human medical teams arrived within 24 hours. They brought equipment, treatment protocols, research data, and most importantly, experience. They worked alongside Pelion doctors, teaching them the techniques Webb's team had developed. Final fatality rate, 31%. The Pelion call humans deathworld angels now. I think that's weird, but whatever. 5 years after Kepler, the Galactic Health Consortium revised all containment protocols. Evacuation is still an option, but it's no longer the only asterisk option. We now have rapid response medical teams, trained by humans, equipped with human-developed protocols, ready to fight instead of flee. I'm in charge of one of those teams now. I spend my time training other species in aggressive containment and treatment protocols. It's harder than evacuation. It's more dangerous. The casualties are still too high, but we're saving people who would have been abandoned. We're fighting instead of running. And every single time I brief a new team, I tell them about Kepler 442, about a governor who refused to abandon her people, about a doctor who believed 18% was better than 0%, about a colony that looked at a 100% fatality rate and said, not yet. Because that's what humans taught us. That yet makes all the difference. Sometimes the scariest thing in the universe isn't the plague or the disaster or the death. It's the people who look at certain doom and decide to fight anyway. And sometimes, just sometimes, they win. Epilogue asterisk. I visited Kepler 442b again last month. The memorial has more names now: the volunteers who died fighting the plague, the researchers who gave their lives to develop treatments. But next to it is something new, a wall with 14,872 plaques, each with a name and a date. That's everyone we saved, Chen told me. She's older now, retired from government, but still active in the Medical Research Institute. You count them? I asked. Every single one, she confirmed. We want to remember the dead, yes, but also the living, because that's the point, isn't it? Not that people died, but that people lived. She handed me something, a small metal pin shaped like a microscope. What's this? Honorary member of the Kepler Medical Corps, she said. You've earned it. You learned to fight. I attached it to my uniform. It sits there now next to my consortium badge. 2 different philosophies, 2 different approaches to the same universe. But maybe, just maybe, we're figuring out how to do both. We contain, but we also fight. We protect, but we also save. We're practical, but we're also human. Or at least we're learning to be.